Welcome to our comprehensive guide on high-yield fundamentals for the NCLEX exam. If you're preparing to become a registered nurse, mastering these core concepts is essential for your success. In this video, we'll break down the most frequently tested topics, providing clear explanations and practical tips. Whether you're reviewing or just starting your study journey, these fundamentals will help you build a strong foundation. Let's dive in and explore what you need to know to ace the NCLEX and start your nursing career with confidence. One of the most tested frameworks on the NCLEX is Maslow's hierarchy of needs. This model helps prioritize patient care by focusing on basic physiological needs first, such as breathing, food, and water, before addressing higher-level needs like safety and self-actualization. When answering questions, always consider what the patient needs most urgently. For example, airway and breathing issues take precedence over emotional concern. Remembering this hierarchy can help you select the best answer when faced with multiple priorities. ABCs, airway, breathing, and circulation, are fundamental in emergency and routine care. NCLEX questions often require you to identify which patient to see first or which intervention is most urgent. Always address airway issues before moving on to breathing or circulation. For instance, a patient with an obstructed airway is a higher priority than one with low blood pressure. This systematic approach ensures patient safety and effective care delivery. Infection control is a cornerstone of nursing practice. The NCLEX frequently tests your understanding of standard precautions, transmission-based precautions, and hand hygiene. Always use gloves when in contact with blood or body fluids, and remember the correct order for donning and doffing personal protective equipment. Knowing which diseases require contact, droplet, or airborne precautions can help you answer scenario-based questions accurately. Accurate assessment of vital signs is a fundamental nursing skill. The NCLEX may ask about normal ranges for temperature, pulse, respiration, and blood pressure, as well as how to interpret abnormal findings. For example, recognizing signs of shock or infection through changes in vital signs is critical. Practice measuring and documenting these values, and understand what interventions are needed when values fall outside the normal range. Safe medication administration is a key area on the NCLEX. You'll need to know the 5 rights: right patient, right drug, right dose, right route, and right time. Questions may also cover how to handle medication errors, patient education, and special considerations for high-risk drugs. Always double-check orders and clarify any unclear instructions with the provider. Patient safety depends on your attention to detail. Ensuring patient safety is a top priority in nursing care. The NCLEX tests your knowledge of fall prevention strategies, such as keeping the bed in a low position, using non-slip socks, and ensuring call lights are within reach. Assessing a patient's risk for falls and implementing appropriate interventions can prevent injuries and improve outcomes. Always report hazards and follow facility protocols to maintain a safe environment. Effective communication is essential for building trust and ensuring quality care. The NCLEX may present scenarios involving therapeutic communication techniques, such as active listening, open-ended questions, and providing reassurance. Avoid giving false hope or making judgments. Instead, focus on empathy and clarity. Good communication also includes proper documentation and timely reporting of changes in patient status. Understanding legal and ethical principles is vital for safe nursing practice. The NCLEX tests your knowledge of patient rights, informed consent, confidentiality, and ethical dilemmas. Always respect patient autonomy and privacy and know when to report unsafe practices. If you're unsure about an ethical issue, refer to the Nursing Code of Ethics and seek guidance from supervisors or ethics committees. Patient education is a crucial part of nursing care. The NCLEX may ask how to teach patients about medications, procedures, or lifestyle changes. Use simple language, assess the patient's readiness to learn, and confirm understanding through teach-back methods. Tailor your approach to the patient's age, culture, and literacy level. Effective education empowers patients to participate in their care and make informed decisions. Delegation is a key skill for registered nurses. The NCLEX tests your ability to assign tasks appropriately to licensed practical nurses, LPNs, nursing assistants, and other team members. Always consider the scope of practice, patient safety, and the complexity of the task. Supervise delegated tasks and provide feedback as needed. Effective delegation ensures efficient care and allows you to focus on critical responsibilities. Accurate and timely documentation is essential for legal protection and quality care. The NCLEX may ask about best practices, such as charting only what you observe, avoiding abbreviations, and recording interventions immediately after they occur. Remember, if it's not documented, it didn't happen. Good documentation supports communication among the healthcare team and ensures continuity of care. Pain management is a frequent topic on the NCLEX. Assess pain using standardized scales and ask patients to describe their pain's location, intensity, and duration. Interventions may include medications, repositioning, or non-pharmacological methods like relaxation techniques. Always reassess pain after interventions and document the patient's response. Effective pain management improves patient comfort and outcome. Proper nutrition and hydration are essential for healing and recovery. The NCLEX may test your knowledge of dietary needs, fluid balance, and signs of dehydration or malnutrition. Assess patients for swallowing difficulties and monitor intake and output. Collaborate with dietitians and provide education on healthy eating habits. Early intervention can prevent complications and promote optimal health. Maintaining fluid and electrolyte balance is critical for patient stability. The NCLEX often includes questions about recognizing imbalances, such as dehydration, overhydration, or electrolyte disturbances like hyponatremia and hyperkalemia. Know the signs and symptoms as well as appropriate interventions. Monitoring lab values and patient status helps prevent serious complications. Elimination is a basic human need, and the NCLEX may test your knowledge of urinary and bowel care. Assess for signs of retention, incontinence, or constipation, and implement interventions such as toileting schedules or dietary changes. Monitor output and report abnormalities. Maintaining elimination helps prevent discomfort and complications like infections or skin breakdown. Mobility is vital for maintaining health, but some patients may be at risk for immobility-related complications. The NCLEX may ask about interventions to prevent pressure ulcers, deep vein thrombosis, or muscle atrophy. Encourage movement, use assistive devices, and reposition patients regularly. Early mobilization supports recovery and reduces the risk of complications. Protecting skin integrity is a key nursing responsibility. The NCLEX may test your knowledge of wound assessment, staging pressure ulcers, and implementing prevention strategies. Keep skin clean and dry, use barrier creams, and turn patients frequently. Early identification and intervention can prevent wounds from worsening and promote healing. Ensuring adequate oxygenation is fundamental in nursing care. The NCLEX may include questions about assessing respiratory status, administering oxygen, and recognizing signs of hypoxia. Monitor respiratory rate, oxygen saturation, and breath sounds. Intervene promptly if you notice changes, and educate patients on breathing exercises or use of incentive spirometers. Cardiovascular assessment is a core skill for nurses. The NCLEX may test your ability to recognize abnormal heart sounds, assess pulses, and identify signs of poor perfusion. Monitor blood pressure, heart rate, and look for symptoms like chest pain or edema. Early detection of cardiovascular issues can prevent complications and improve patient outcomes. Assessing neurological status is essential for detecting changes in patient condition. The NCLEX may ask about level of consciousness, pupil response, and motor function. Use standardized tools like the Glasgow Coma Scale and document findings accurately. Recognizing early signs of neurological decline allows for prompt intervention and better outcomes. Perioperative care involves preparing patients for surgery, monitoring during the procedure, and supporting recovery. The NCLEX may test your knowledge of preoperative teaching, informed consent, and postoperative assessments. Monitor for complications like infection or bleeding, and provide pain management. Effective perioperative care ensures patient safety and smooth recovery. Providing compassionate end-of-life care is an important aspect of nursing. The NCLEX may include questions about palliative care, pain management, and supporting families. Focus on comfort, dignity, and respecting patient wishes. Communicate openly and provide emotional support to both patients and their loved ones during this difficult time. Cultural competence is essential for providing patient-centered care. The NCLEX may test your ability to respect cultural differences, address language barriers, and incorporate cultural beliefs into care plans. Always ask about preferences and avoid making assumptions. Being culturally sensitive improves patient trust and health outcomes. Understanding growth and development across the lifespan is key for nurses. The NCLEX may include questions about developmental milestones, age-appropriate interventions, and communication strategies for different age groups. Tailor your care to the patient's developmental stage, whether caring for infants, children, adults, or the elderly. Health promotion and disease prevention are core nursing responsibilities. The NCLEX may ask about screening guidelines, immunizations, and patient education. Encourage healthy behaviors, provide resources, and support patients in making lifestyle changes. Early detection and prevention improve long-term health outcomes. Adequate sleep and rest are vital for healing and well-being. The NCLEX may test your knowledge of sleep disorders, interventions to promote rest, and the impact of sleep deprivation. Assess sleep patterns, minimize disturbances, and educate patients on good sleep hygiene. Supporting rest improves recovery and overall health. Managing stress and supporting coping mechanisms are important nursing roles. The NCLEX may include questions about identifying stressors, teaching relaxation techniques, and referring patients to support services. Encourage open communication and provide resources for mental health support. Effective stress management improves patient resilience and recovery. Preventing infection is a daily responsibility for nurses. The NCLEX may test your knowledge of aseptic technique, isolation precautions, and sterilization methods. Always follow protocols for hand hygiene, equipment cleaning, and waste disposal. Early identification and intervention can stop the spread of infection and protect vulnerable patients. Being prepared for emergencies is crucial in nursing. The NCLEX may include scenarios involving cardiac arrest, choking, or trauma. Know the steps for basic life support, including CPR and use of automated external defibrillators. Stay calm, act quickly, and follow established protocols to save lives and minimize harm. Proper patient positioning is essential for comfort, safety, and effective treatment. The NCLEX may test your knowledge of positions like Fowler's, supine, or lateral, and when to use each. Positioning can prevent complications such as aspiration or pressure ulcers. Always assess patient needs and use supports as necessary. Collecting specimens accurately is important for diagnosis and treatment. The NCLEX may ask about techniques for collecting blood, urine, or sputum samples. Always follow standard precautions, label specimens correctly, and transport them promptly. Proper collection ensures reliable results and guides patient care. Intravenous IV therapy is a common nursing procedure. The NCLEX may test your knowledge of starting IVs, monitoring for complications, and calculating drip rates. Watch for signs of infiltration, phlebitis, or infection. Always use aseptic technique and document site assessments regularly. Blood transfusions require careful monitoring and adherence to protocols. The NCLEX may ask about verifying patient identity, monitoring for reactions, and documenting transfusions. Watch for signs of allergic or hemolytic reactions and stop the transfusion immediately if they occur. Patient safety is the top priority during transfusions. Patients require enteral or parenteral nutrition when they can't eat by mouth. The NCLEX may test your knowledge of tube feeding, TPN administration, and monitoring for complications. Ensure tube placement, monitor for aspiration, and assess for signs of infection or metabolic imbalances. Proper care supports nutrition and recovery. Caring for urinary catheters is a routine nursing task. The NCLEX may ask about insertion techniques, infection prevention, and monitoring for complications. Use sterile technique during insertion, secure the catheter properly, and monitor for signs of infection. Regular assessment and care prevent complications and promote patient comfort. Ostomy care involves managing stomas and appliances. The NCLEX may test your knowledge of skin care, appliance changes, and patient education. Assess the stoma for color and output, keep the skin clean and dry, and teach patients how to care for their ostomy. Support and education help patients adjust to life with an ostomy. Isolation precautions protect patients and staff from infectious diseases. The NCLEX may ask about contact, droplet, and airborne precautions, as well as appropriate use of personal protective equipment. Always follow protocols and educate patients and visitors about the importance of isolation measures. Correct patient identification is critical for safety. The NCLEX may test your knowledge of using two identifiers such as name and date of birth before administering medications or procedures. Always verify patient identity and avoid shortcuts. Accurate identification prevents errors and ensures safe care. Advocating for patients is a fundamental nursing role. The NCLEX may include scenarios where you must speak up for patient rights, ensure informed consent, or address unsafe practices. Always act in the patient's best interest and communicate concerns to the healthcare team. Advocacy promotes patient safety and ethical care. Discharge planning begins at admission and ensures a smooth transition from hospital to home. The NCLEX may test your knowledge of patient education, follow-up appointments, and community resources. Assess patient needs, provide clear instructions, and coordinate with the healthcare team. Good discharge planning reduces readmissions and supports recovery. Effective time management is essential for nurses. The NCLEX may include questions about prioritizing care, organizing tasks, and managing interruptions. Use tools like to-do lists and delegate when appropriate. Staying organized helps you provide safe, efficient care and reduces stress. Quality improvement focuses on enhancing patient care and safety. The NCLEX may test your knowledge of reporting errors, participating in audits, and using evidence-based practices. Always look for ways to improve processes and outcomes. Being involved in quality initiatives demonstrates professionalism and commitment to excellence. Continuing education and professional development are important for nurses. The NCLEX may ask about maintaining licensure, attending trainings, and staying current with best practices. Seek opportunities for growth, join professional organizations, and pursue certifications. Lifelong learning supports your career and improves patient care. We've covered a wide range of high-yield fundamentals that are frequently tested on the NCLEX exam. Remember to focus on patient safety, prioritize care using frameworks like Maslow's hierarchy and the ABCs, and always follow best practices. Consistent review and practice will help you feel confident on exam day. Good luck on your journey to becoming a registered nurse.